Hi, this is Amin Ibrahimi, physical therapist, and today we're going to talk about prevention in sports injuries. As Benjamin Franklin, American scientist and political philosopher, once said, an ounce of prevention is worth a pound of cure. One of the building blocks of a healthy lifestyle across the lifespan is physical activity, which is encouraged by all doctors. But injuries are unfortunate and common parts of the fitness procedure and are faced by both competitive and recreational athletes. The stress that the body can tolerate and the limits of the body's abilities are challenged in sports, and this is where injuries can happen. Sports injuries are widely categorized into two kinds: acute injuries, which happen suddenly, and chronic injuries, which are usually related to overuse and develop gradually over time. In some cases, wear and tear from overuse injuries can set the stage for acute injuries. The most common sports injuries are rotator cuff injury, tennis elbow, golf elbow, runner's knee, ligament, tendon, or meniscal tear, hamstring strain, and ankle sprain. The risk factors for sports injuries include not using the correct exercise technique, overtraining, either by training too often, too frequently, or for too long, changing the intensity of physical activity too quickly, running or jumping on hard surfaces, wearing shoes that do not have enough support, having had a prior injury, having certain anatomical features specific to each joint or poor flexibility. The type of injury you're most vulnerable to depends on the type of activity you participate in, your age, and your sex. Treatment for sports injuries depends on the type of injury, but minor ones can usually be treated at home by resting, icing, compressing, and elevating the injured parts of the body. For more serious injuries, you will need to see a healthcare provider and you may need to be set up for a course of physical therapy. In some cases, you may need surgery. A rehabilitation program that includes exercise and other types of therapy is usually recommended before resuming the sports or activity that caused the injury. A sport injury prevention program can reduce the number of injuries as well as the severity and extent of injuries. But how can I prevent a sports injury? The following are some basic steps to prevent a sports injury. Create a fitness plan that includes cardiovascular exercise, strength training, and flexibility. This will help decrease your chance of injury. It is extremely crucial that you do some dynamic stretches before starting to play. Cold muscles are more prone to injuries, so while it might be tempting to start playing immediately, you should take a few minutes to do some jumping jacks, butt kicks, or arm circles first. Cool down correctly after exercise or sports. It should take 2 times as long as your warm ups. Stay hydrated. Drink water to prevent dehydration, heat exhaustion, and heat stroke. Stretching exercises can improve the ability of muscles to contract and perform. This can reduce the risk of injury. Each stretch should start slowly until you reach a point of muscle tension. Stretching should not be painful. Aim to hold each stretch for up to 20 seconds. Rest when tired. Don't exercise when you're tired or in pain. If you do have a sports injury, make sure you get as much rehab as you needed before starting a strenuous activity. To avoid re injuring yourself, check with your doctor to make sure that your injury has recovered fully and you're clear to resume playing.